And we're going to be talking in this last section about how many resources we actually have out there. So, and Brent and I will be doing this, although it's a little odd. Some of the things we'll be talking about, the actual people that lead some of these efforts are here on our meeting. So please feel free to chime in on those if you would like. So again, how can you get involved in our suicide preventions throughout the state? What are some of the local and national resources? And we're also going to talk about some of the apps and other things that are available for you. So here's some of the things that you can do. Join us. You've had this training. I would already say that makes you part an advocate. You went that extra effort. If you feel like you want to learn more, there are many, many ways to get involved, to read up and get aware of the services, to get trained. The trainings are kind of stepped. We talked about some things in different aspects. There's other types of trainings if you want to continue to practice, maybe asking the question, and we'll talk about what those types of trainings might be. Just talk about it. Oh, guess what? I attended this really great training on resiliency and suicide prevention the last couple of days, and here's something I learned. Share that with your family, your friends, people in your workplace, wherever. And again, based on all of the comments and things people were putting in, the We Belong activity that we did, this is a caring group, right? The people attending here, and just go ahead and share that. And of course, taking care of yourself, so crucial, right? So who are some of our local partners? Our state legislature has provided funding. This was something that our suicide prevention community pushed for, and we're able to secure not only some funds that go to suicide prevention, but also a position. And so we have a suicide prevention coordinator in the state in the Department of Health, and her name is Renee. And so, she's a great link. She sends out a monthly newsletter that tells you things that are going on. They share the data so we know what's happening locally, and we can, get a snapshot of that. We do have a strategic plan that's part of a partnership, and we are audacious and ambitious in what our plan is. We set forth that we want to reduce suicide 25% by 2025. That's plan was written in 2018. And so, we've got our work cut out for us, but we're willing to accept that challenge. So feel free, our email is here. Again, you're going to receive these slides. But if you want to get on that list, we're great if you can join us for things. And you'll see, all the different activities. And if you have something you want to share, again, you can put that out to her, and it'll go out to this listserv, which we have hundreds of people on already. Join up with one of our task forces. We have a statewide task force. We're active. I am a co-chair, along with Gina from Hawai. And we meet on the third Thursdays of the even months. There's another easier way to say that, from 2 to 4. It is a Zoom meeting. Join when you can. We usually have at least half of the meeting devoted to some kind of educational aspect, and another half to figure out what's going on and network, and just find out what's happening with folks. Our Oahu task force has a meeting this month, and then it's going on a short hiatus as we look for new leadership. But we do have activities going on Oahu all the time. These are some of the trainings that are offered on a regular basis. So again, it's kind of a natural next step. If you enjoyed having those kind of compassionate and caring conversations, and you want to get a few more skills in that, you can sign up for the Safe Talk trainings. Again, our training coordinator for the state is a contract through the University of Hawaii's Office of Public Health Studies, and that's Dr. Janelle Sugimoto Matsuda. So you can contact her. Her email is listed here. She can set that up. We also have these other ones, if you want to work on protocol for your work or an organization, maybe that's a Connect training. If you want to be involved in that crisis moment and be able to have those lengthy conversations, then that's an Assist training. If you just want another basics or set up a basics, maybe for your congregation, then we do have like a short 1-hour training that could be done. We have lots and lots of mental health first aid, especially for the youth, although we also have the adult version, and that's another possibility. And then I mentioned earlier the Ho'olopono Youth Suicide and Bullying Prevention done by Mental Health America. So there's that training as well. So we've got like lots of different opportunities, and they offer things in different ways, but we're here for you. We have a new initiative that we're just starting. Dr. Janelle and I are leading a systems initiative. So we're going to be working with education, healthcare, and community on hope, help, healing, and structures, and trying to improve those transitions. So if somebody went into the hospital, how can we transition them back into the community and make that process smoother and follow them and surround them, and then just building different areas. So we're just rolling that out. And so we're starting with initial meetings. A lot of people haven't even heard yet that we've been funded. Suicide Prevention Month. Great time because there's lots of activities and it's really to get engaged. And there'll be different things happening. Not sure to what degree some of them will be in person this year. Last year we were completely virtual, but there's always something going on. And so I think you'll be able to find something statewide again, communities doing different things. And so September's, just put that in your calendar. There's going to be something happening in that month. We partner with the Hawaii chapter of the American Foundation for Suicide Prevention. This really is our group that works on loss and has a lot of resources for that, what we call postvention, which is after a death. Mestiza, Dr. G, is a co-chair for that. So again, and full disclosure, I'm on their board. They have been a great partner for our state in terms of really looking at that healing aspect that's so important. Actually, this month, as we speak, you can join the Hike for Hope. I have a slide on that on the next page. They also have the Out of Darkness Community Walk, which is an awareness walk, a great for people that want to honor someone that they've lost to suicide by taking part in a walk and helping to raise awareness about this issue. But we provide survivor groups and just really a lot of advocacy around that. So as I mentioned, the Hike for Hope is available, and this is a fundraising event throughout June. Again, also trying to raise awareness, right? We do a lot of things that is the primary purpose. And they also provide the Heartfelt Hope and Healing Grief Group. It is being offered on Zoom. So if anyone is interested in being part of the support group, our respite person from one of our respite people from yesterday, Auntie Pua, is a contact person for that. She's on Oahu. We were allowed to combine our efforts with Kauai now that we've moved to so many things virtually, and this is being offered that way. And they meet the third Wednesday of every month from 6 to 7:30. It's one of the few places where people in that group all have that shared experience of suicide loss. We do have some individuals, myself included, that if there has been a suicide death in a community and someone wants to provide something for youth, and the schools can do something, but sometimes it's done through other avenues. I've done this with primarily church groups and others where they've wanted to set something up for that immediate after to help with the youth and provide support to youth. And so we can do that as well, but there's Kids Hurt Too, and that's a broader group. It operates out of Kapiolani, and they provide support groups to children that are grieving. And there's just a whole bunch of resources with respect to grief. I encourage everyone to look at them. They also have a lot of activities to deal with loss, death, and grief. The Doogie Center, they actually developed the Kids Hurt Too curriculum, as well as the one that the American Foundation for Suicide Prevention uses for youth. So really great resources out there. Our partner, Mental Health America of Hawaii, of which Amanda and Mestiza are part of. Again, they are just fantastic. They also have an office on Maui. They've developed some great trainings. They started with their youth suicide and bullying prevention. They have a Grow Rainbow workshop. And this year they just blew us out of the water with all of the stuff that they're doing in self-care. I don't even, with different training aspects, and you saw some of the videos and just expanding. They also have this comprehensive directory, and they do advocacy work, and I can't say enough positive things about them. I think they're a fantastic partner for suicide prevention. They do have an app called kakualife. And you can see it has all these different things. So if you're looking for a place to go, oh, what are the warning signs for suicide? They're on here. Where do I find help? Here it is. Hook up to that. It's definitely a plus. Another local partner that we have is NAMI, the National Alliance for Mental Illness. So if you know anyone that has family members with that have a mental illness, it's really helpful when maybe there's like something newly diagnosed and people are trying to figure out. NAMI is a great place to go, and they do a lot of different trainings, and you can see them on the left-hand side in terms of like, what do I need to know about this? What's coming my way? How do I deal with this? I need to, I just want more information and to find out about that, and maybe some connections. And they have that from family and for friends and support groups and different types of connections for faith and other groups. And their overall goal is to reduce stigma. So another great partner. These are all the numbers you need in your cell phones. Put them in now. That's my key. I think, Brent, this is about where we're switching over, because you're going to do some of the national ones. And some of these are national and some are local. I'm going to comment on the Hawaii Cares line. This is one of our 24/7 crisis. It used to be the crisis line. That number has expanded. It's like they're trying to make it your entryway into services. So definitely for substance abuse, if somebody's trying to find substance abuse treatment services, if you call that number, they're going to connect you. Because of COVID, they've added a whole bunch of programs related to stress and COVID, and that's your entrance for all of those programs. And it's also the crisis line. It is if you need to get somebody for mobile crisis outreach, to get someone to drive to somebody's home and then be able to start having that conversation in person. This is your entryway for that. Right now, because they're doing all of these things, and I think expanded so quickly, we've heard a couple people getting busy signals. So always also give some of these other things. If you give people the lifeline, the suicide prevention lifeline, that 1-800-273-TALK, that's 1-800-273-8255 number. If people call from an 808 number, they're going to end up getting connected to the crisis line, the Hawaii Cares number, if it's available. Otherwise, it'll get handled by another state. So we're part of this national network in order to take part in that. And the text line, our kids love. In the work groups that I've done, when we've met with them, we've actually taken time. They've texted to see how it works, to see if they feel comfortable, what it's like. They say it's not an emergency if people are able to handle it. And they've been really happy in referring their friends and handing out that number. So definitely text. Just as kind of a side story. I was at a training, actually a Ho'olohipono training, Mental Health America's training. And one of the kids afterwards said, "Is it okay if I text you? I want to follow up on something and I don't want to talk about it right now." And I was like, "Oh, okay." I tried to give local resources, and he was pretty insistent. So I said yes. And I gave him my number. And literally 1 minute later, he was texting me. He had actually gone into the supply closet and was texting me. He wasn't comfortable telling his story in person. He got all of the tough stuff out, and then he came to talk with me afterwards. But it was all done on text. So they really like that. They're really comfortable with that. So we want to make sure we know those numbers. And then the Trevor Project, that's our LGBTQ plus line that's available for text, chat, and they're also online. So with that, I'm going to switch over and I'm going to mute myself, I think, and let Brent take the next couple slides, and I will.
Thanks, Deb. Appreciate it. It's a good segue to go into talking about some of the national resources that we have to offer. So folks, if you look over here, for a lot of our military, since we have in Hawaii, we have pretty much all the services there. There is a military one source line. We in the military, we train a lot. I mean, there's annual training, there's mandatory trainings, and military has to do this all the time because I'm not sure if you guys have heard, the military suicides have been on the rise. And so right now the military is trying to get a good grip on what's happening. We're working very closely with one source. We're working very closely with the crisis hotlines, the veteran hotlines. So for those that work with some military or even, have veterans or family members or friends that are veterans, try to get them connected with some of these national hotlines, because we know that sometimes our folks out there are not going to stay on island. Maybe they might be traveling to another location or moving to another location. And so national hotlines are always great to have because they work anywhere you go. I'm in Guam, and we push out the one source number even to folks in Guam, and they can still call this 1-800 number and get assistance for those non-medical counseling. And the one source has more than just counseling services. They have financial counselors, they have peer specialists, they have educational specialists. There's so much that of course the federal government got a lot of money. They pay into the one source to have a one-stop shop for all your service members and veterans to get assistance. So if anybody knows, this is the hotline that they can reach out to. We also make sure all military members, when they get the trainings, that they also put this number into their cell phones. We know that a lot of service members today, they probably don't go anywhere else without their cell phone. So that's the best way to get when they have it in their phone. You got the Hawaii Poison Hotline. That's a great another number to reach in case, of course, as another part of my business is also teaching substance abuse. When people abuse substances or they ingest something that really is toxic to themselves, there's a national hotline that they can call to get help. Or, of course, the universal emergency number, which is the 911. We'll go to the next slide. Here are some national organizations as well. We covered some. We covered over NAMI, National Institute for Mental Health, or NIMH, which is National Institute of Mental Health. They have a lot of resources and just helping folks with, information, have some policies out there. SAMHSA is another national organization. It's both substance abuse and mental health. They, what's interesting about SAMHSA is they actually have a national registry for evidence-based practices. So if you want to look at all the evidence-based practices, best practices that's out there, you go to SAMHSA, look under their national registry, and you look at all the different curriculums that have been evaluated and actually been deemed evidence-based. So when I do trainings, I like to look at some of those, and I like to train the stuff that's evidence-based, because of course, when it's evidence-based, a lot of grants fund it. A lot of organizations, you get some federal dollars or state funding that can pay for evidence-based practices that you can use these curriculums and teach. And even the stuff that we do, which is anything that was developed by LivingWorks, the Safe Talk, the assist classes that we offer in our communities, a lot of them have been already evaluated and have been deemed as evidence-based. So if you're interested, just go to look at SAMHSA, under their national registry, and you can actually find a lot of these different trainings and curriculums that's offered throughout the entire nation. Not to mention, also SAMHSA pushes out tons of policies and guidelines and stuff that, a lot of us probably could use or even maybe embed into some of our own programs. If you want resources, and I always say resources, think of resources as tools. stuff that you can put in your, like your tool bag or your toolbox. Well, how much tools do we have? And I say the more the merrier, because anywhere you go, you're probably going to need something someday from someplace. Sometimes I go to SPRC just to kind of look and see what other states have. And there's a list, a huge list of what every organization with states have. And then you can actually, see what works in their states compared to others. For the military, I travel a lot. So what might work for some place like in Guam might definitely not work in Alaska or for Japan or Korea. So when you look into SPRC, you're kind of looking at, either geographically, whether it's nationally or internationally, what are some of the resources that some of these locations have to offer that we can kind of help utilize for our folks? If you travel a lot, or even if you're going to relocate someday, these are some of the great national organizations that can help us with that. Because like I said, for the population that I work with, they never stay in one place too long. After about 3-4 years, they're already relocating. So these are good information for us if we're sharing it for folks, especially for, anybody who works in the schools, universities. How many of your young adults out there is going to stay in the state or maybe move back home or might need some of these national resources? And that's why we got some of these today. We also got this one, is a big one, which is the Defense Suicide Prevention Office. We call it DESPO. They actually work very closely with the Department of Defense. All policies and guidelines and all these things that all these military branches are doing gets generated from the Department of Suicide Prevention Office. Even some of our new curriculums, they're kind of like the SAMHSA for our military, even though they don't wear a uniform, because they're still government owned and government funded. So that's really, really helping our military, trying to reduce the amount of suicide we have in our military. Because I would say DESPO is not they haven't been around very long. I could probably think, if so long as I remember, they've been around for maybe less than 10 years already. But they've been doing a lot of advances, a lot of good things when it comes to policies in our military and how to better service our programs. All service programs have a program manager. I mean, every branch, even when it comes out to the National Guards and Reserves out there. And we all work very closely with each other. So like Deb talked about some of the task forces that we have in our state and in our counties. Well, we actually have a joint military task force in Hawaii as well that brings all the suicide prevention programs together within all the branches, to include also our VA. Even the VA has a huge program when it comes to suicide prevention. In fact, most of those national crisis hotlines that people call, if they press the option 1 and they go to the Veterans Crisis Hotline, the person will be connected straight to the VA. And their VA suicide prevention program, they have a bunch of case managers that take those crisis calls. And if it's an active duty member, or if it's the National Guards or reservists, they'll be linked up with those military program managers. So that's how well connected these services are. Just like our state crisis hotline. Our state crisis hotline are mostly linked with mostly all the other crisis hotlines as well. We'll go to the next slide. So now I want to go into something a little bit different, because we talk about resources, about things that we have nationally and locally, but let's talk about some of the things that we actually have with us on ourselves at all times. We do have things called apps, and we have a lot of them on our phones. And if you look at your phone, I'm sure we have a lot on it. But what are some of the health and wellness apps that we have? I want you guys to go ahead and just go ahead and turn on your phone. I know I'm giving permission for us to grab our phones and look at while we're in training, and just look at some of the apps that you have. Do we have anything pertaining to health and wellness? Anything that can kind of help us to, alleviate, de-stress, take care of ourselves? Besides, Instagram, Snapchat, Facebook, TikTok, all these other ones out there. And I want us to think about it. If we don't, then, maybe we should put some of them on. There's a ton and tons of health and wellness apps that are free. There are, of course, there's some that you have to pay for, but there are a lot of ones that, if you just look and scroll, whether it's to your Apple store or whatever store you get your apps from, just kind of look at some of the things that you can download for free that can help us. I see that Jolene put Calm. Calm is great. Calm is free. I think they also charge if you want more stuff. But Calm, actually, there's so many things that Calm can do. I like Deb. Deb got the virtual hope box. Deb, you're right. I got the same thing on my phone. That was one of the first things because it has games on there. It has, so many games. You can put upload your own pictures. I got like pictures of my dog, pictures of the beach, pictures, all kinds of things, Amanda says she's got the paid version of Calm. Wow, you got the free? Wow, I got to get the Kaiser plan then. And that's awesome because there's so much out there. This is just one of them. This is just one. We'll look at the next one, the next slide. Yes, there's a ton of meditation apps. And remember, we talked about a lot of things we do physically, right, for self-care. But then when it comes to our mental health care, some of these things help relieve us of stress. There's even apps out there to, talk suicide, to talk suicide safe, suicide planning. Remember, I talked yesterday about having a safe plan, a safety plan. Some of the apps actually helps people to create that. It talks about the warning signs, coping strategies, reasons to live. There's so many things that are out there. There are kids that have apps out there just for kids. I think there's a bully button app out there that, the kid gets bullied. Well, heck, how do kids react to that? Of course, they don't know how. They just, close themselves from other people. They don't talk to anybody. But, there's some apps that if they can connect with, because we know most kids have phones by now. I know kids all the way down to 9, 10 years old that has a cell phone that can use it better than I can. If we put some of these health and wellness apps, like say, a bullying button on it or some kind of app that can help them with bullying, some of these apps, what it does is when they feel they're getting bullied or harassed or teased, they turn that phone on, they turn that app on. It'll probably take a video. It'll send that video to either a parent or teacher, however it's set up to. And one, you got evidence of what's happening. Two, you got somebody to get intervene, which is a parent, adult, or a counselor. And three, somebody can connect with that child and talk to that child about what's happening and how to get help. And that's how technology is really, really helping us by, just taking care of ourselves, whether it's kids, whether it's adults. And I know as we get older, it's getting a little bit more challenging using these little technical devices, but these are just some of them that really help us. Meditation, to de-stress. Even if we're depressed, there's some apps that can kind of talk to us or help coach us. PTSD coach, that's one that I give a lot of service members. If you just want to get happier, have some mindfulness, maybe mindfulness meditation. And for for people that's anxious or have anxiety, there is a breathe relax app. There's tons of different breathing exercises we can do. We just did a little activity earlier. So a lot of good stuff that we have out there. I encourage all of us to really look and search and put at least a good 5 of these apps on our phone. The reason why I say 5 is because 1 is not enough. 2, we might not even see it. If you have 5 of these apps on your phone, because I got probably 30 or 40 of them on my phone, at least I know one day I'm accidentally going to hit one of them and it's going to remind me, oh yeah, I need to take a step back. I need to take a chill or relax a bit, decompress, because we're so busy today. I've even heard in some of our private groups we had earlier that we're so busy today and working, we hardly take time for ourselves. And because of the pandemic, it seems like we're working more and we're getting overwhelmed and we're getting stressed a lot more. And whatever we hear, whether it's on the media or we hear from other people, it's not so much good stuff. It's kind of bad. So sometimes, we want to use technology for our advantage here. And maybe we do have to disconnect from the social media, disconnect from what we're hearing on TV or the media, and maybe try and practice more of this, more of our focus on more of our mental health and well-being. And if these apps can really help us, then I say, hey, it works. I encourage you also to talk to people about these things, because some people realize that they rather use social media, just whether it's gathering, really just being more involved in other people's lives, or just being connected socially through media that way. But really, is it healthy for them? And so talk to them about, like, if they put some of these things on that may help them mentally, then they might find themselves a little bit more healthier. Next slide. Oh, look at that. We got a lot of websites too. A lot of good websites that can help the youth. These are just a few of them out here that can help kids, keep them involved, got some activities on there for them. And I say keep them busy, because kids, if they're not busy, involved with something to be creative, then sometimes they can become a little destructive out there. So keep them busy, keep them involved, and always talk to them and share with them, information that we use for ourselves.